Welcome back, everyone. We're diving into the world of medical education today.
Always an exciting space.
It really is. And we're not just looking at what doctors learn, but how they learn it.
The how is definitely where it gets interesting.
Absolutely. So we're tackling implementation science, or IS for short.
Right, because having the latest research and actually changing how doctors are trained, those are two different things.
Exactly. And you've shared some excerpts from a research review. It's called From Evidence to Practice, a narrative review of implementation science's role in medical education. I'm really curious to dig into this with you.
It's a crucial area, especially in medicine. Staying updated can be the difference between life or death, literally.
Absolutely. You'd think that with all the medical breakthroughs happening, keeping up would be a given, but...
But it's way more complicated than just handing out a new textbook.
Right. That's what we're about to explore. It's more than just having the information, it's putting it into practice.
Exactly, and that's where IS comes in. It acknowledges that there's a whole science to making knowledge work in the real world. Think of it like having a blueprint for an incredible building. That's your research, but actually building it. You need the construction skills, the project management, the right tools.
So it's the difference between having the plan and executing it.
Perfectly put. And that's where these frameworks, CFIR, our aim, they come in. They offer a structured approach.
I've got to be honest, those acronyms sound a bit intimidating.
They do, don't they? Don't worry, we'll break them down. Let's start with CFIR, Consolidated Framework for Implementation Research. Think of it as like a detective's checklist.
I like where this is going.
So a medical school wants to implement a new teaching method, right? CFIR helps them ask the tough questions. Do they have support from leadership? Do they even have the resources, money, staff to do this? Is the culture even open to change?
That makes so much sense.
Yeah.
Because you can have the best idea in the world, but without the right support or the resources.
It goes nowhere. And that's where our aim comes in, making sure changes are not only put in place, but that they last.
So it's about sustainability, too.
Exactly. Our aim: reach, effectiveness, adoption, implementation, and maintenance. That's what it stands for. It's about making sure a program reaches the right people, actually works, gets adopted widely, is implemented correctly, and sticks around. It's not just a one-time thing.
It becomes part of how things are done.
Exactly. And the paper highlights some cool examples, like adopting new teaching methods, e-learning platforms, simulations.
Oh, you mean like those VR simulations for surgeons to practice before they even step into an operating room?
Exactly. Implementation science in action. These technologies are amazing, but they only work if they're integrated well. That's where our aim has been crucial.
So it's not about having shiny new tech. It's about using it to actually improve learning and ultimately patient care.
That's the goal. And the fascinating part is that IS isn't just about adopting tech, it's about understanding people. Because people can be resistant.
I can only imagine, even in a field as important as medicine, there's got to be pushback on new ways of doing things.
Oh, absolutely. One of the biggest challenges highlighted is this: resistance to change. It's everywhere, even in medicine. Doctors are brilliant, dedicated, but...
But they're human. They get used to doing things a certain way.
Exactly. Plus, medicine's got a long history. And not all of it has been about embracing new ideas readily.
That's true. Old habits die hard, as they say.
Exactly. There are traditional mindsets to overcome, sometimes even skepticism towards new approaches.
And I'm guessing limited resources don't help either. I can't imagine medical schools have tons of extra cash just lying around.
You've hit on another major challenge: implementing new programs, new tech, evaluating what works. All of it needs money, something many medical schools struggle with.
So it's like you need implementation science just to implement implementation science.
A little bit meta, right? But it shows how important this field is. If we figure out how to implement change well in a system as complex as medicine, imagine the possibilities for other fields.
It's about learning how to learn, period.
That's it. Which is why this deep dive is relevant, even if you aren't planning on performing surgery anytime soon.
So we've got the challenges: resistance, resources. But the paper doesn't just leave us with doom and gloom, does it? There has to be some hope for the future of medical education.
Absolutely. And it's not just about throwing money at the problem, though that wouldn't hurt. The paper digs into some cool possibilities, especially with technology.
Okay, now you've got my attention. Tech-driven solutions. Tell me more.
Imagine AI personalizing medical education. Systems that adapt to how each student learns best, identify their strengths, weaknesses, then tailor the curriculum just for them.
That sounds like something out of a sci-fi movie. but also incredibly cool. So no more one-size-fits-all lectures.
Exactly. AI could mean truly personalized learning. Plus, it can help us analyze mountains of data to see what teaching methods are really working and for whom.
So we can ditch what's not working.
Exactly. This data-driven approach can help us understand those barriers to change we talked about and come up with even better ways to overcome them.
It's like having an army of data crunching assistants making medical education smarter.
I like the way you think. And it's not just about AI working alone. The paper also highlights something else: interdisciplinary collaboration. Imagine doctors learning alongside nurses, pharmacists, even social workers. From day one,
Wow, teamwork from the very beginning. That's got to be a game changer.
it is. This kind of collaboration breaks down those walls that can exist between different healthcare professions. It makes sure everyone's on the same page with the latest research, best practices.
A unified front when it comes to patient care.
You got it. It fosters a culture of continuous learning and teamwork right from the start of a medical career.
So we've got AI-powered personalized learning, interdisciplinary dream teams.
Yeah.
What else is on this implementation science wish list?
One of the most important, more long-term studies. Right now, a lot of the research looks at the immediate impact of a new program, new tech. But what happens after a year, 2 years, 5 years down the line?
Right. Do these changes actually last? Do they lead to better outcomes for patients?
That's what we need to find out. We can't just check a box and say we did it. We need to follow through, track these initiatives, gather data, and see if they're truly moving the needle on patient outcomes.
Making sure it's not just a temporary fix. So it sounds like IS is bigger than just making medical education better. It's about using a scientific approach to how we learn and adapt. In any field, really.
Exactly. We get excited about the newest research, the shiniest new tech.
The latest and greatest.
Right. But we don't always put the same effort into figuring out how to actually use them in real life. That's where implementation science comes in.
It's like that saying, knowledge is power, but only if you know how to use it.
Now you're getting it. This paper focused on medical education, but what if we use these same ideas in other areas?
My mind's already racing. What if we use IS to change how we teach kids about climate change? Or how companies implement ethical AI guidelines?
I love where your head's at. That's exactly the kind of thinking this field encourages, looking beyond the what and into the how of actually making change happen.
So many possibilities. But before we get too carried away, let's bring it back to our listeners. What's the key takeaway from this deep dive into IS and medical education?
The key takeaway is that brilliant ideas, groundbreaking research, they aren't enough. We need a system, a science, to bridge that gap between what we know and what we do.
Bridging that gap between knowledge and action.
That's it.
And that is what implementation science is all about, taking that leap from knowing to doing and making sure those changes stick.
Couldn't have said it better myself.
It's interesting how this resistance to change keeps coming up. It makes sense, though, like you said, we're creatures of habit. But in a field like medicine where there's always something new being discovered, how do you balance respecting the old ways with embracing the new?
It's a tough balance, for sure. And the paper actually addresses that directly. One of the big takeaways is that simply presenting new information, it isn't enough. You have to create a culture where change is seen as an opportunity, not a threat, a chance to grow.
So it's about shifting that mindset from, we've always done it this way, to, how can we do it even better?
Exactly. And that means tackling those ingrained beliefs, those fears, head on. You need clear evidence showing why this new approach is better, plus support and training to help people adapt.
It sounds like communication and collaboration are key here.
Absolutely. You need to bring everyone along on this journey. Make them feel like they're part of the solution, not the problem. And that's not just doctors, but nurses, pharmacists, technicians, the whole team.
Which takes us back to that interdisciplinary approach we talked about. It's not just about individual professions staying up to date, it's about everyone being on the same page.
Precisely. Because at the end of the day, it's the patients who benefit from a more integrated, a more informed approach to healthcare.
So how do you measure success in implementation science? Is it just about whether or not a new program gets adopted, or is there a deeper level of evaluation?
That's an important question, and the research really stresses the need for good evaluation. One thing they emphasize is looking beyond those immediate outcomes. Like, okay, people are using the new tech, but is it actually leading to better patient care? Are we seeing fewer complications, shorter hospital stays, real improvement?
It's about making sure the changes have a real impact, that they're not just superficial.
Exactly. And that's where those long-term studies we touched on earlier become crucial. We need to track these changes over time, see if they're truly making a difference.
It's pretty amazing to think about how this is shaping the future of medicine.
It really is. And while we've been talking about medicine specifically, these principles, these strategies, they can be used in so many other areas.
It makes you think about all the other parts of life where we're constantly bombarded with new information, new technologies, new ways of doing things, from education and business to just our personal lives. We're all dealing with this challenge of implementation.
That's right. And that's why understanding implementation science, even just the basics, can be so valuable no matter what you do or what you're interested in.
Because at the end of the day, it's not enough to just have the knowledge. You have to know how to use it, how to put it into practice in a way that creates real change.
Now you're getting it.
It's amazing how important something as like basic as communication is in those critical care situations.
It really shows how IS isn't just about the newest technology or some fancy program. It's about the human factor and how we can address that, just like we would any scientific problem.
It's like you said, changing how people think, not just what they're using.
Right, because you can have the most advanced tech in the world, the most well-designed program, but if the people using it aren't on board, it's not going to work.
Makes you wonder where else in healthcare this approach could be useful.
Oh, tons of places, I'm sure. Think about preventative care, public health, even tackling those really complex issues like health disparities.
The possibilities are pretty mind-blowing.
They are, and it highlights something really important. IS isn't about chasing the latest trend. It's about doing things better, making them more effective, more equitable for everyone.
Now that's something we can all get behind.
I agree.
As we start to wrap up, what are some key things you hope our listeners take away from this conversation?
Well, first off, I hope they have a better understanding of what IS is and why it matters. This isn't just some theoretical thing. It's changing how we think about everything from medical education to patient care to so many other fields.
It's about connecting research to reality.
Exactly. And second, I hope they realize that IS is relevant to everyone. It's not just for scientists. Whether you're a student, a CEO, someone raising a family, these principles can help you be more effective in your own life.
Setting goals, figuring out obstacles, coming up with strategies, seeing what works.
Exactly. And lastly, I hope they feel empowered to be the ones who make change happen. Implementation science isn't about waiting for someone else to fix things. It's about giving ourselves the tools and the mindset to make a difference.
It's about realizing that change is possible and that we all have a part to play.
Well said.
This has been a fantastic conversation. Thank you so much for joining us and sharing your expertise on such a fascinating and important topic.
It's been my pleasure.
And to our listeners, thanks for joining us on this deep dive into implementation science. Until next time, stay curious and keep exploring new ideas.